Good morning. You are now listening to Morning Sign-In, where we will talk about the latest in health-related research. The song you just heard is Indie Guitar Opener by Flores, spelled Florews.
As a disclaimer before we start, the Morning Sign-In show is not run by healthcare professionals. As a result, we ask that you do not use the information provided as medical advice. The content on Morning Sign-In is meant to be educational and entertaining, and some of it comes from research which reports conclusions rather than gives professional opinions. If you are in a life-threatening healthcare emergency, please contact 911. Thank you, and please enjoy the show.
Hey everyone, this is DJ Lee,
DJ Dree.
And DJ Tay signing in.
Today, we'll be covering health literacy, what it is, what are statistics on it, and what to do to increase health literacy. Then, we'll launch into a conversation with each other about health literacy and how it's affected our lives.
we hope you stay tuned for this conversation after learning about health literacy. Alright, we'll begin Morning Sign-In episode 2. But before the song, a random question to ponder.
Which of the following is commonly associated with a source of vitamin C? Oranges, eggs, beef, or whole grains? The answer will be given after the music break. Here's a song, Memories, by Liborio Conti. That was Memories by Liborio Conti. Now, moving on to the answer from before. Drumroll, please. Okay, I guess there's none. The answer is oranges. You can view more on vitamin C on the website of Harvard's T.H. Chan School of Public Health. Well, delving straight into the topic, what is health literacy? The National Institutes for Health, or NIH, provides the classic definition of health literacy, adopted from two governmental efforts called Healthy People 2010 and Healthy People 2020. So this is quoted from their website, and it will be very long, but it's a very useful definition. It states the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. The new definitions emphasize people's ability to use health information rather than just understand it, focus on the ability to make well-informed decisions rather than just appropriate ones, incorporate a public health perspective, and acknowledge that organizations have a responsibility to address health literacy. So the source acknowledges the complexity of health literacy since it involves individuals and their communities, hence the public health perspective. Also, it doesn't just involve being literate or well-read in health topics, but also being able to use and leverage knowledge as a patient. Lastly, health literacy involves decisions made by patients themselves. Now that we know what health literacy is, here are a few findings of literacy research. 1. We must not blame the individual for not understanding information that has not been made clear. And 2. Everyone, no matter how educated, is at risk for misunderstanding health information if the topic is emotionally charged or complex. 3. In almost all cases, physicians and other health professionals try to, and believe they are, communicating accurate information. 4. In some cases, patients may believe they have understood directions but may be embarrassed to ask questions to confirm their understanding. 5. Healthcare organizations and their systems and procedures have a significant role to play in ensuring understanding in the healthcare setting. 6. It is increasingly difficult for people to separate evidence-based information, especially online, from misleading ads and gimmicks. 7. The communication of risk in an effective and fair way continues to be a challenge for both the provider and the patient. And 8. There are additional challenges in understanding how to select insurance plans and benefits, especially for those who have not been previously insured. So, in these 8 findings listed by the NIH, we see concerns brought up around access to reliable information, the patient-provider relationship, objectivity versus subjectivity, so in other words, staying unbiased is hard when facing challenging health situations, and health insurance. Now, we should understand that health literacy is really a broad topic. Fellow DJs Dree and Lee will discuss more. Let's stop for a music break. Here's a song You Found Me by Liborio Conti. See you in a few minutes.
You just listened to You Found Me by Liborio Conti. Thanks for the intro to health literacy, DJ Tay. Now, you mentioned the national initiatives of Healthy People 2010 and 2020 earlier. These are basically efforts that are led by the U.S. Department of Health and Human Services Office of Disease Prevention and Health Promotion, and their goal is to study and improve national health. Let's take a look at what Healthy People 2030 has to say about health literacy. The main initiative of Healthy People 2030 is to improve health literacy throughout the nation over the next decade so that everyone, no matter their background, is well equipped to manage their own health. As described on their website, a person's level of health literacy and the quality of their health in general can be heavily influenced by factors called the social determinants of health. So the social determinants of health are aspects of your life and environment that impact your day-to-day experiences. They come in 5 main categories, so let's go through them one by one. Number 1, we have economic stability. So an example of this is maybe your ability to afford resources like healthy food. The second is education access and quality. Say your level of education allows you to have more confidence in understanding your diagnosis when you go visit the doctor, but someone who has lower education access might not have this feeling that they can understand what the doctor is saying to them or understand how the treatment works. Third, healthcare access and quality. So depending on your insurance, how easy is it for you to get the care that you need? Can you go see a specialist without having to get a referral from your regular doctor? Or maybe, do you even have insurance? Can you afford the healthcare treatment that you need? Fourth, we have neighborhood and built environment. More simply put, this is the place that you live, the area around you. So like, can you access a park easily to get daily physical exercise? Or maybe there's a lot of pollution in the city that you live in. Fifth, we have social and community context. Do you have a strong support system to lean on when you need help? Do you feel comfortable talking to someone about your healthcare questions? So it's important to know also that none of these 5 factors exist in isolation. For example, your economic stability can also influence the insurance you can afford, which influences your ability to access healthcare, which is another social determinant of health. So any insecurity in any one of these 5 factors can affect one another, and they can also be a source of stress for the individual. And as you may know, stress and your mental well-being will affect your physical well-being, and just overall your quality of health is going to be impacted if you are stressing about your ability to cover any one of these 5 determinants. And each of these factors is different for everybody. We all have a unique toolbox when it comes to our ability to understand and manage our health. This is why Healthy People 2030 says that health literacy is split into 2 categories: personal literacy and organizational health literacy. Now, your personal health literacy is pretty straightforward. It focuses on what is your ability to understand and use the resources around you to answer and enrich your health-related questions. So that includes how you use the information that you get to make health-related decisions for you and your loved ones. This is the type of literacy that is unique to each person, and as a result, it's the one that varies very widely based on your specific set of life experiences and based on how the 5 social determinants of health that we discussed before impact your life. Now, what's that second type of health literacy that I mentioned? Organizational health literacy. That's defined as, I quote from Healthy People 2030, the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. In other words, This is basically how organizations like Healthy People 2030 themselves help the community to access and understand health-related resources. If an organization has high health literacy, it likely also has a wide reach to various parts of the community. Maybe it's easily accessible, and it also gives information that can be quickly and easily understood by a member of the general population, which, is everyday people like you and me. For example, the Mayo Clinic website, that's an example of good organizational health literacy, because if you visit their website, you can see it breaks down the basics of a wide variety of conditions in a simple to understand way. It's put into common language and not too cluttered by complicated vocab terms. They also post all their information on the web for anybody with internet access to be able to read. If you type in a certain medical condition into Google, it's often one of those first few websites that comes up. And so it's very easy for the general population to access and learn more about medical conditions and medical diagnoses. So as you can probably guess, organizational health literacy is a little bit harder to control than your personal health literacy, but still it's important to acknowledge, because it's important to realize that it's the responsibility of bigger official groups to help the community as a whole to access and understand health and medicine. It's not a solo effort. Everybody has to contribute. If you'd like to learn more about Healthy People 2030, you can visit the website health.gov/healthypeople with no spaces. So now that we've gone over the concepts of health literacy, what does that look like in real life? Imagine for a second that you heard about a new vaccine, and I know we've all been there in the past few years. So imagine you're trying to decide, whether or not to get it. You don't know much about this vaccine. So your very first step is to acknowledge that you've got a question. Now, where do you go to receive that information? Maybe you turn to the internet, or books, or other people. Where should you go to find the answer? So, say you find an article about the success rates of the vaccine based on a recent study that came out a couple months ago, and you found it on their internet. Now, your next step is to look at how credible is your source. So, like I said in our example, we found it on the internet, but, what if you were talking to a person? The credibility of the information that you get would depend on, did you get it from a friend? Did you get it from a doctor? Which one of those is more credible? And back to our example, you found it on the internet. So what is more credible? Getting it off of a blog post? Or did you get it off of a medical organization's main website? So, say for our example purposes, you found this article about the vaccine from the CDC. Great! Finding a source from a well-known organization is often a better bet than getting it from an informal source like Reddit or Instagram. You want to find a good, credible organization that you can trust in order to get you correct health information. Now, your third step, read the article and see what terms are confusing. Maybe you don't quite get the concept of immunity, or you've never heard of a placebo before. A huge part of health literacy is being able to break down and understand the information you find. If you break it apart piece by piece, you can make sure that you fully understand all the new knowledge in its entirety. And, it makes it a whole lot less intimidating. So now that you hopefully feel like you know what health literacy is, we're going to go into what contributes to low health literacy and health literacy statistics here in Los Angeles. Catch this and more after a music break with Whip by Praz Canal. That's PRAZKHANAL. Enjoy!
That was Whip by Praz Kanal, spelled Prazkhanal. Thanks DJ Dree for sharing more about what health literacy is and some examples of health literacy in real-life applications. Before we transition into what factors contribute to low health literacy, I also want to bring up an article by Alexander King, published in the renowned scientific journal Nature, that gives another clear example of what health literacy looks like when applied to our daily lives and something that we might not have noticed about it. King states that things like, quote, information about their condition, hospital discharge instructions, patient consent forms, and even medication bottles is written at a high level of literacy. The shocking part here is that these instructions, forms, labels, etc., these things that are necessary for us to know in order to take care of ourselves, like what side effects our medications could give us and other aspects to know while we're on medications, or how signing a particular consent form could actually impact us once an issue arises, needs an education level required at the 11th grade level. The 11th grade level. I have to agree with Alexander King on this, that a disparity clearly exists. Then we could ask, how does low health literacy actually affect us? King states, quote, low health literacy has been associated with non-adherence to treatment plans and medical regimens, poor patient self-care, high healthcare costs, and increased risk of hospitalization and mortality. This then leads us into what factors can contribute to low health literacy. In the Journal of Nurse Practitioners, an article called Low Health Literacy, Implications for Managing Cardiac Patients in Practice, states that low health is associated with, quote, patients who are older, have limited education, lower income, chronic conditions, and non-native English speakers. While insurance is another issue, it's discussed in one chapter of the book, Just What Did the Doctor Order?, addressing low health literacy in North Carolina, and the chapter is called The Problem of Low Health Literacy, written by those at North Carolina Institute of Medicine. Essentially, what they tell us is that people who get support from publicly sponsored health insurance, like Medicare or Medicaid, have lower average health literacy levels than those who get their insurance from employers, private parties, etc. They say that the results weren't surprising because Medicare is a health insurance program that supports older adults that are 65 years of age or older, and because Medicaid supports those with low incomes. How can we solve this issue of low health literacy? Well, that's a bit complicated. Let's go back to King's article in the journal Nature. Well, essentially, they're saying that physicians could potentially try to identify which patients might be at risk of low health literacy using some tests that are already out there. But others are saying that rather, things should in general just be made easier for everyone to read. One thing that's already been done to address the issue, according to the article, is that the UK National Health Service actually made guidelines, like, I'm quoting from the article here, using a large bold font, bulleted lists, short sentences, avoiding long words and technical terms, and using basic diagrams and pictures that can make the text more accessible. Another point I want to add is that the article states something that I think is really, really important, which is this, quote, much of the research on the impact of health literacy has focused on the patient's ability to read written health information. This approach may underestimate the prevalence of poor health literacy. However, because it uses too narrow a view of literacy and does not take into account listening, speaking, and writing. Being able to listen effectively and communicate questions to the physician is just as important in health literacy as reading. King says that strategies like avoiding technical medical jargon when explaining health concepts to patients, asking patients to explain the information they just received, being aware of cultural perspectives and views on medicine, and adult education programs could be of great help. Before we end this section, let's talk about stats, because stats is how we can gauge how immense of an issue low health literacy is in the current day. Well, according to the Los Angeles County Department of Public Health, I quote, "In LA County, 53% of adults have low literacy levels, affecting their ability to search for and use health information, adopt healthy behaviors, and act on important public health alerts." These are pretty big numbers that we want to decrease. The University of North Carolina at Chapel Hill also provides a health literacy data map of the nation. According to their data, the central area of Los Angeles County is in the lowest quartile of health literacy levels nationwide. More troubling, though, is the rates of low health literacy statewide. According to the California Health Literacy Initiative, quote, "More than 5 million Californians, 1 in 4 adults, are functionally illiterate." But with more efforts for health literacy and awareness, these numbers can be lowered. Alright, that was a lot of important information. Let's give your mind a break with Embrace by It's Water, spelled ITSWATR.
Hey everybody, it's DJ Dree here again. That was Embrace by It's Water. That's ITSWATR. Turns out there's a lot going on in our community and in the world as a whole to improve health literacy. Let's delve into the latest health education news from around the world, shall we? First up, we've got the National Action Plan to improve health literacy. This comes to us from our friends back at health.gov. the same people who brought us Healthy People 2030, which I was talking about earlier. And remember how I mentioned the difference between personal and organizational health literacy before? Well, the National Action Plan to Improve Health Literacy focuses on the organizational aspect. It outlines 7 goals that organizations can use to improve the way that people interact with and understand the health information that's put out into the world. The full plan, which is accessible on their website, includes various strategies for organizations to achieve this goal. One organization that you might know that uses it is the Center for Disease Control, the CDC itself. An example of how the CDC implements this National Action Plan is its emphasis on plain language in any sort of medical or health explanation. That means taking out any, overly scientific, overly complicated terms in their explanations and replacing them with more commonly known terms so that anyone can grasp the information that is put out, not only people with a medical background. That really helps to clarify all the information that is being communicated by the CDC, and it really helps to get everybody on the same page using the same common language. Another type of plan, the mandate for health literacy by the World Health Organization, also does a similar thing to this National Action Plan. So the mandate for health literacy is a mandate that outlines goals and strategies to achieve better health literacy, better health education by 2030. One thing that they really heavily emphasize is the impact of education on health and other aspects of well-being. An example that they cite is providing engaging and effective reproductive health education, which is important for equipping teenagers and young adults with the knowledge on how to avoid sexually transmitted infections and unwanted pregnancies. So just like that National Action Plan, the mandate for health literacy is looking at the important aspects of our world that maybe might need a little bit of bolstering, a little bit of improvement, and really emphasizing them to improve health education and how we approach health literacy in the communities from an organizational standpoint. A little more unofficially, let's take a look at social media and health literacy. Now this one is a little bit of a mixed bag. It's got some good things about it, some bad things. So let's take a look. The rise of social media in our lives has seen the birth of a new kind of medical information, and that's in the form of patient influencers. As described by an article from the National Institute of Health, or NIH, in 2022 by Dr. Erin Willis and Dr. Marjorie Delbert, patient influencers are patients that share their experiences with a condition online, often through social media outlets like TikTok and Instagram. One of the benefits of these influencers is the closer emotional level at which they can relate to others. And, they have this unique perspective on living with condition and grappling with it that they can use to discuss, their experience with the condition and how it might affect anyone who might be watching who also has the condition can relate to that patient. This high relatability is even being leveraged by pharmaceutical companies to allow patients to share their experiences with certain drugs or treatment products. However, like all things on the internet, this source should be taken with a grain of salt. Patient influencers are often not medical professionals, and their experiences may not be applicable to everybody. Beyond that, the fact that pharmaceutical companies are starting to use some patient influencers as a form of advertising, it introduces possible bias that can mislead people into believing a treatment works better than it truly does for everybody. So, in conclusion, patient influencers and other social media outlets are a good way to, bring medical information in a more informal, more relatable way, but at the same time, you still need to look out for the credibility of these sources and make sure any information that you learn, you also remember to fact check and remember to ask your doctor before starting any sort of treatment plan or making any really drastic health change based on the information that you learn. Moving on, let's look at some efforts to improve health literacy directly in the community as a whole. From the University of Hawaii, as described in an article from earlier this January by the University of Hawaii Manoa News, the university's Thompson School of Public Health has a $4 million research project in full swing. And this project explores the importance of cultural liaisons in healthcare, both in Hawaii and beyond. Cultural liaisons are people that explain medical processes and health-related information in a way that's relatable to patients because the liaisons themselves are part of a patient's community. The project done by the University of Hawaii has highlighted the power of a shared perspective to increase trust and belonging in a healthcare setting. And this is really helping to tackle problems such as maybe racial disparities in a healthcare setting or how different cultural perspectives affect the way that patients understand information and the kind of relationship that patients have with their medical providers, like their doctors and their nurses. And with the cultural liaisons being able to help, they're able to bridge that gap, if there is one, to help the patients feel more at ease, more at home in this unfamiliar healthcare setting. And the project at the University of Hawaii is really showing how much of an impact that makes on making health literacy, making health education accessible to everyday people.
DJ Lee here. I actually want to add some points to DJ Dree's awesome discussion. Like DJ Dree said, we have a ton of information and resources on the internet and maybe even an overload. The University of Maryland actually has a whole page with links that can help us improve our health literacy. One of the links they recommend takes you to a page from the National Library of Medicine and has a tutorial that you can use to learn how to navigate and evaluate the health information that you see online. Another site the University of Maryland recommends is a page from a nonprofit called RX Outreach. On this page, RX Outreach tells more about how to understand your prescription label. So, careful and informed use of the internet is one strategy to improve health literacy. What are some other strategies we can use? According to breastcancer.org, some strategies include asking questions, repeating what your doctor tells you in your own words, bringing someone else, like a friend, to your appointment so they can catch things you might not have, ask for a patient navigator who is a trained worker who helps navigate the healthcare system for support, and asking for any materials that you can take home with you. Summit Health also gives some more strategies. These include having a plan/agenda when you go into your visit, using things like your hospital's mobile apps to access and review your health record, as well as communicate with your physician, attending health education lectures, and providing feedback to your physician, hospital, etc. And best resource of all, I have to say, is definitely Morning Sign Out at UCLA. Shameless plug, I know. But our members do a lot of work understanding and translating the latest scientific research from reliable sources into articles that are easier to read. In addition, our writers actually get their work proofread by editors, and their article goes through a strenuous process of revision. Alright, before we move on, let's listen to Home by Penguin Music, spelled PenguinMusic. You just listened to Home by Penguin Music, spelled PenguinMusic. Now, time for a conversation between the three of us. Here's the first question. What are your own personal experiences with health literacy?
I can answer first. Well, I think that health literacy has a lot to do with what's called language concordance. And this is actually the correspondence between the language spoken by a medical provider and the patient. So, for example, if I were a patient, I would be language concordant with English-speaking medical providers and vice versa. And actually, weekly, I meet with Spanish-speaking patients who are struggling with a language divide, and it can be really tempting to dub them as individuals with low health literacy. But this is really a tendency from an English-speaking point of view. And in my perspective, it's important to evaluate patients and community members based on their health literacy in some linguistic environment that feels familiar. Then to acknowledge that in this kind of American English-speaking environment, they may have shortcomings because of this language barrier. I will say that previous research does demonstrate benefits of language concordance, meaning that it can be advantageous to have interpreters or even medical providers themselves who understand the first languages of non-English speakers. As someone who's personally interested in learning more about other languages, I believe that it's important to practice them so you're at least capable of communicating at some sort of basic level with phrases like, oh, I don't understand much, or please wait here for me to get someone else. Anyhow, anyone else have any comments?
Yeah, that was a great example. I guess in my own experience, health literacy in my life has been helping my little brother understand his asthma diagnosis. So back when I was in middle school, my little brother got diagnosed with asthma, and it was a really uncertain time for my family. Especially at that point, none of us had experienced asthma ourselves, and none of us even had medications to take on a regular basis. And all of a sudden, my brother had like 2 or 3 different things to take at night. And I remember one thing that really helped us through it, especially for me and my brother, because we were so little, was to look up educational videos on what asthma was, how inhalers work, what these different medications were, all that stuff to make the unfamiliar into something understandable. It's kind of like being afraid of the dark. Things are a lot scarier when you can't see what's going on, but the ability to find resources and answer the questions you have helps you regain your footing. That's probably one of my earliest memories of how health literacy has impacted my life. DJ Lee, what about you?
Yeah, well, for me, I myself couldn't control my own health literacy, and that's actually why I joined Morning Sign Out, because it was a way for me to not only read the scientific research that was being published so that, I myself could stay aware of what was happening in the medical field, but also use my newfound knowledge and experiences to help others navigate their health as well. So if we talk about the question of what does health literacy mean to you, I'd say that for me personally, health literacy means to not only be able to take control of my health, but it also means helping others take control of theirs. And through Morning Sign Out, I can definitely say that I'm getting closer to this goal of mine. Morning Sign Out actually partners with a nonprofit called the Gifted Living Institute, and I was actually outreach director for 2 years with the Gifted Living Institute, and we've been able to make booklets about things like drug abuse and good mental health and distribute them to residents in low-income communities. In addition, as the host of our podcast last year, we've also been able to share our work with others at a much larger scale. And of course, this year, our co-hosts DJ Tay and DJ Dree and I are aiming to continue these efforts through this podcast. All right, so DJ Tay, what would you say health literacy means to you?
Yeah, good question. And by the way, I'd also like to say that health literacy was a really big draw for me joining MSO as well. Well, typically health literacy relates to understanding from the patient's perspective, but to me it's also all about openness and transparency of really communication in medical sciences. So when we think about the nature of science, what does it really serve to do? Does it serve to work in isolation, or is it better off as a multidisciplinary effort? And from my perspective, I would say that's better off being multidisciplinary, and therefore this involves constant collaboration between fields. Well, in healthcare, this applies to collaboration between medical providers and their patients. And providers should work with a variety of specialists, including interpreters and also medical correspondents, to convey information in a reliable way to the public. So, health literacy involves not just the individual responsibility of the patients and providers to keep up on health information, but also the system's obligation as a whole. What about you, DJ Dree?
Yeah, I totally agree with both of you. Those are such good points. I would say to me, health literacy really means empowering ourselves not to just understand medical information, but to also use it as a tool to apply in our daily lives. And when we have that gift, it's also important to share it with others. So like DJ Tay was saying, that difference between personal and organizational health literacy is definitely there, but it's important to acknowledge both of them. And like, especially when you're an organization that, you know, has all this medical information, it's really important to be able to convey that in a way that everybody can understand. And so, like, in my life, like, whether for my own health decisions or for my family, it's rewarding to be able to break down news articles or research studies and share what I learn with others. That's actually what made me join Morning Sign Out in the first place. It feels so rewarding to be at a point where I'm able to bridge the gap between the scientific world that I love learning about and the real world, that real community in front of us. So like DJ Lee was saying, the ability to really go out into like the LA community, like with Gifted, and help to spread health literacy right here in LA, that's something really special.
Thanks, DJ Dree. Well, that concludes this week's podcast. Thanks for tuning in with us, Morning Sign-In, where we provide the latest scientific research and make research more accessible and easy to understand. Again, if you are curious about more of our work, make sure to check out our website at www.mso@ucla.org. Here, you will find all of our past and recently published articles by our members, brief translations of some of these articles, our podcast on other platforms like Spotify and Apple Music, and much, much more. Also, make sure to check out our Instagram at mso.ucla to stay updated. Playing now is Moments by Coma Media, spelled COMA-MEDIA.
Signing out, this was DJ Tay.
DJ Dree.
And DJ Lee. See you next week.